Hello, everyone. Welcome to the pre-health webinar for Canisius College. Joined today with some Canisius pre-med students and then also a couple of graduates of the program as well. My name is Jack Knights. I'm an admissions counselor here at Canisius. So we have a really good mix of students here today. We have some students that are coming in the fall as well as some juniors that might just be starting their college search. So people sort of all along the journey of the college search process, right? So I'll go ahead and turn it over to Dr. Backstrom and I think everybody's going to introduce himself here. So go ahead, Dr. Backstrom.
Great, well, welcome everyone. Glad you could join us on this wonderful spring, almost summer day. So got a great group joining us tonight and excited to tell you about the program here at Canisius. So I'm Allison Backstrom. I'm the director of the pre-medical program. And I'm going to let each of our students / alumni introduce themselves briefly. And then after we talk to you a little bit about the program, I'm going to have them all come back in and talk about their individual experiences here at Canisius. And then we'll answer questions. So Hannah, do you want to start?
Hi guys, I'm Hannah and I just graduated from Canisius actually. I was a chemistry major for the health professions track, so a little bit different than like the typical chemistry track. But yeah, so I'm a graduate and then I'm heading off to DC in August to do a year of service and then hopefully medical school.
Definitely medical school.
For sure.
All right, Caleb?
Hi guys, my name is Caleb. I am a biology major and a rising senior. I am also thinking about doing a year of service when I graduate, but my career track is a physician assistant.
Okay. Joe?
Hey everyone, my name is Joe Lesh. I graduated a couple years ago in 2017 with Bree, who's also on the call. I was also a chemistry health track major like Hannah. And then I took 2 years off after college and did a little bit of working and traveling. And now I'm finishing up my first year at UB's medical school here in Buffalo.
And Bree.
Hello, everyone. My name is Brianna Gibney, and I was in Joe's class. We graduated in 2017. My major at Canisius was medical laboratory science. And I worked for 2 years full-time in the lab before starting medical school. And I'm finishing up my first year of medical school at Oakland University, William Beaumont School of Medicine in Michigan.
Great, welcome everyone. So nice to see everybody, even if it's from a distance. Okay, so Jack, if you'll work your magic and I'll
Well, just share your screen there at the bottom with the green arrow, Dr. Backstrom.
Things going. Okay.
All right.
All right. So just to see everyone's name in writing here and my email address, and I will also follow up with everybody so that you can ask any additional questions after the webinar that might come up. And let's see, there we go. Before I start, I just have to give a shout out to all the alumni and all of our current and future students who are working in health professions. There's nothing more important right now than to recognize that you guys are our current and our future heroes, and we salute you, and I'm truly honored to be able to work with students going into these health professions. So, Canisius, we work with students that go into the full range of health professions. So, medicine, dentistry, veterinary medicine, pharmacy, optometry, physical therapy, occupational therapy, physician assistant, nursing, public health, the whole range. So any health profession, the pre-med center here is going to be helping you get into those graduate programs. Okay. So students often wonder, what does it take to get into these graduate health professions? Not surprisingly, you do need a very strong undergraduate academic profession. You need, or preparation, I should say, strong grades and strong test scores on various entrance exams for the different health professions. You need strong recommendations from professors or from our college committee. You need a really strong understanding of what profession you're hoping to go into. You need to be fully committed to serving others. I think that's evident in the news every day during this pandemic. And most importantly, you really need to become the best version of you. So you don't worry about what anybody else is doing alongside of you, but really be focused on how you can be the absolute best you that you can be. So we're really proud here at Canisius at our excellent acceptance rates to medical and dental school, 86, 85%. And those numbers come out of the students who apply and alumni who apply, working through a committee that we have here on campus that recommends students into these health professional schools. And what we do is we take a 5-year snapshot and average out those numbers. So typical year, we're sending 20, 25 students, even more, off to medical school, half a dozen or so off to dental school, 3 to 5 maybe to vet school, and handful in all those other health professions that we've been talking about. So the last 3 years, we've actually sent 91 students off to medical, dental, and vet school, over 250 since 2013. That's not counting this year. If we add in this year, we're not quite through the current cycle, but so far we've got at least 21 students and alumni accepted to medical school for this next cycle. So it's pretty amazing numbers. And we currently have 38 of our alumni attending school at the UB Jacobs School of Medicine. And next year, that number ought to be up above 45. So quite a few of our students do stay at our local medical school. So how is it that we're able to achieve these kinds of numbers? 3 primary things. First, we have institutional and alumni commitment to our pre-med, pre-health program and our students. Second, we have a very rigorous Jesuit education. And third, our location makes a big difference in terms of what students are able to experience and learn. So just a couple of things that our alumni help with. We do have a medical advisory board. So we have about 50 local physicians and other leaders in the health profession that serve on an advisory board that help with our undergraduates' preparation. So this picture here is actually a networking event where a bunch of local doctors are doing these little roundtable discussions with our students. It's a bit like speed dating, where students were able to talk to a couple of doctors, move to another table, talk to a couple more doctors, and just get a sense about the breadth of medicine. The lower right-hand picture is actually practice interviews where our alumni are back helping our students prepare for their admissions interviews. And then this PEPID logo, this is the logo of a company that was founded by one of our alums. It's a medical informatics company, and they take a small team of our students every semester out to Arizona, train them up on medical informatics software, and then the students come back to Buffalo and continue an internship throughout the rest of the semester. And they help develop content to help clinicians make decisions in their work. So a little bit about that Jesuit education. Jesuits have a long and strong tradition of academic excellence. They're noted for rigorous science education, and then both of our core curriculum and our honors program curriculum have a heavy focus on things like ethics, philosophy, religion, things that really help students develop critical thinking skills and a sense of justice and ethical behavior. The Jesuits are always in the city. So Some groups tend to be out remote, but Jesuits have always been in the midst of the city. So any of the Jesuit universities here in the US or around the world, you're going to find them in kind of in metropolitan areas or in the heart of a city. So Canisius, we're right on Main Street, right in the heart of things. Okay. That allows us to be in the midst of the people. So we're not isolating ourselves from people. We're really embracing being with people. So one of the Jesuit tenets is being with and for others. And so our location really matters for that. And probably some of our panelists can speak to that a bit later. A couple of other Jesuit principles that really help our pre-health students are cura personalis, which refers to care for the whole person. So to be a healthcare provider, it's not enough to just worry about the physical. It's equally important to worry about the mind and the spirit. So mind, body, spirit. And then the principle of magis, which means always doing more. So we really try to instill in our students this notion that whatever we're doing, whether it's our studies, whether it's helping someone else, we should always be doing more. And one of our other medical alumni who spoke to some students a couple of months ago kind of summed that up. He said that if you use magis as your starting principle for everything, everything else just falls into place for you. And I think he summed that up well. In terms of our education, we have faculty who are fully committed to teaching and fully committed to student success. So we're blessed to have small classes and small laboratories, and our faculty get to know our students very well. So a couple of pictures here. Top one is a Monday night review session for our general biology course, where one of the professors was helping students get ready for an upcoming class. And next door, that same night, we were having a workshop for organic chemistry, which most pre-health students take. And students were also practicing problems for an upcoming test for that class. You might recognize Caleb sitting there in front. In terms of our location, again, Canisius is right on Main Street in Buffalo. We are situated next door to Sisters Hospital. We have 2 metro stops on campus that take us right down to the Buffalo Niagara Medical Campus, where Buffalo General Hospital, the Oshai Children's Hospital, Roswell Park Comprehensive Cancer Institute is, as well as a lot of biotech companies. So all of these are great resources for our students to both do clinical volunteer work and also research and shadowing. And then being in the heart of Buffalo, unfortunately, not everyone has every blessing and opportunity in the world. So we do have a fair amount of people who suffer from lack of resources and have face health disparities. So our students are able to utilize Buffalo as really a learning center to better understand all of the social and economic things that impact people's healths and create health disparities. Harvest House up there in the corner is an organization that our students have been helping out for, gosh, 6-7 years now. They help tutor adults in Buffalo who are trying to get into certified nursing assistant and licensed practical nursing courses. So kind of extending a hand to others that are hoping to get into the healthcare professions. So really the bottom line is our students are motivated, they work hard, they help each other, they take full advantage of all kinds of opportunities that are presented to them, but they also create their own opportunities. And that creates a kind of student that medical and professional schools seek out. So just a couple of activities that we do routinely. Sadly, a few of these had to be on pause this year because of the pandemic, but we are anxious to get back to them as soon as it is safe to do so. So we do an annual medical mission trip to Central America where we work with local doctors, dentists, and other health providers to provide care to underserved communities through offering pop-up clinics. We also have been going on a domestic medical mission trip for a couple of years where we work with an organization called Remote Area Medical to host a big pop-up clinic not too far from here, about 2.5 hours from here, where people who don't have either access or resources to pay for medical, dental, and optical care can come for services. So we've been taking a big team every year. This year, they had to cancel these clinics because of the pandemic, but Remote Area Medical has been utilizing their volunteers to help staff the drive-through testing clinics for COVID. And some of our students and alumni who have participated with Remote Area Medical in the past have helped staff those drive-through clinics. They do have a good time helping out at these clinics. Last year, the students that were volunteering in the vision clinic really had a good time interacting with the folks coming for services. And you can see a couple of our fine young people helping out at the Women's Health Center at the clinic. We, for years, I think 10 years now, have been doing a social justice in health and healthcare service learning trip to Washington, D.C. Everybody who's on the panel tonight has participated in that, so might have things to say about it. And we do things like visit clinics that specialize in serving underserved populations. So Mary's Center is a really amazing community health center down there in Washington, D.C. We help in programs that are targeting food insecure areas of Washington, D.C. So the colorful picture is a grocery store that is set up in one of the elementary schools where kids can come and get food and they learn about healthy eating and try to get them excited about cooking and things like that. And then the upper left picture is touring Georgetown Medical School with one of our alums who's attending there. A couple other pictures. Here's Bree, again, getting kids excited about eating healthy. Joe, having to have a little help lifting that heavy bag of potatoes. He couldn't quite manage it on his own. Bree back there with some celery again. And then the group here, somewhere in the back there is Hannah. This is the Whitman Walker Health Center, which specializes in LGBTQ healthcare. And finally, here's Caleb at DC Central Kitchen, which is a neat organization that helps people who are transitioning out of homelessness and sometimes out of incarceration gain work skills in the food industry so that they can go off and be gainfully employed. And so we do a lot of volunteer work with that organization. We have all kinds of other programming going on back here on campus, different kinds of workshops, speakers, professional schools come to visit. We take students to conferences. We have special study abroad opportunities for our pre-health students, all kinds of service opportunities, and so forth. So top picture there is students doing an EKG workshop to try to get a handle on how one does EKGs. And the bottom picture, this was actually initiated by one of our pre-med students. She invited Dr. Holmes, who's there in the front center with the necktie, and his patient, Mr. Green, who had lung cancer and was terminal and still wanted to make a difference in his life. So they were making the rounds talking to med students about doctor-patient relationship at end of life. And so our pre-med student wanted them to come and talk here at Canisius, and they did, and it was really an impactful session for our students. We have students participate in scholars programs through the American Medical Student Association, and this is a picture of Hannah there off presenting her work at the National Convention. We take students to a health justice conference at the Upstate Medical University on Martin Luther King Jr. Day. And you'll recognize a couple of these faces again. Students go off and study abroad through a couple of specialized programs. Students in our honors program have access to a special study abroad in Glasgow, Scotland, where they get to take gross anatomy and some other courses that are more pre-med focused. And then this picture is actually on an island off of Hong Kong where a team is doing prep work for a seminar in the Philippines before a study abroad program in the Philippines. And we can hear about that in a few minutes. We do have some interesting early assurance programs. These allow students to apply early to programs in medicine, dental, pharmacy, and also veterinary. Some of them have reserved seats for Canisius students. Some of them don't specifically reserve seats for Canisius, but we work with the students to apply to these programs anyway. And then we also have some what we call joint programs, and these joint programs allow students to be at Canisius for 3 years and then go off and start professional school instead of doing their senior year at Canisius, and they transfer the first year of professional school back to Canisius and still graduate with the rest of their class. And I'm not going to go through specific details on any of these programs right now, but I'm happy to answer questions, and it's much more effective to talk one-on-one with people who are interested so we can focus in on those programs that might be most interesting to you. I do want to mention, since we have a local expert with us tonight, Bree, who went through our medical laboratory science program, we do have, it's a 3+1 type program where you spend 3 years on campus here at Canisius, and then you go off to a 1-year hospital-based clinical training program, either in Rochester or Jamestown. And then you graduate from Canisius with a medical laboratory science major and have many job offers before you graduate, because we desperately need people in this field. There's a tremendous shortage right now. They're super important in all of the, or most all diagnoses made in clinical settings. So I would just like to invite anyone, can't invite you to campus right now, unfortunately, but I'm happy to either talk by phone or via Zoom session like this. And it's pretty easy to talk through the kinds of experiences that you've had in high school or the kinds of things you're looking for in college, and even happy to give you some ideas of how you might have a productive summer in quarantine. Don't forget to wear your masks. Okay, so I'm going to stop there and call back in the crowd and ask each of our panelists to talk a little bit, just a couple minutes each about the experiences that you had at Canisius. And then maybe after we do that, especially folks who are out in school, maybe something you wish you would have known about going into the health professions when you were a high school student. And then maybe Caleb and Hannah, folks who are still getting ready to go into professional schools. If you can think back to when you were making your decisions about college, something that maybe you wish you would have known. Okay, so we'll start with maybe telling a little bit about some of the activities you were involved in at Canisius. And I'm just going to go around the virtual room here. So maybe we'll start with Hannah.
All right, so I was very involved with our all-college honors program, as well as our chemistry department, just because I had like a work study there, and then I also got involved with tutoring as well as being a teacher assistant for organic chemistry. But aside from those things, there's like a couple of really cool things I think I could highlight for you guys. So in my freshman year, I did something called the Pre-Med Scholars Program, and we took a course all about different health professions, kind of getting exposed to the different professions, as well like Zoom sessions kind of like this with doctors all over the place. And at the same time, myself and a team of other students started researching sexual health in Buffalo and putting together some patient information / sexual health brochures for a free urban clinic, the Good Neighbors Health Clinic here in Buffalo. And so that information is present in the waiting rooms so that patients have access to updated, relevant, and accurate information. And as you saw in the picture in Dr. Backstrom's slides, we were able to present that at the AMSA conference, which was really cool. All around us were kind of more scientific posters and research, but it was awesome for us to present public health and sexual health research, as well as a project we did that was relevant to the Buffalo community. So then in my junior year, as you also saw in another picture, I was able to study abroad in the Philippines. And so I did that 3-week seminar. It's called Health, Wealth, and Faith in the Philippines. So we did a couple different things, learning about the culture and history of the Philippines, specifically looking at the religion over there, as well as healthcare and the economy. So we were able to visit hospitals that were almost equivalent to hotels, like they would be a dream location, but also hospitals that had beds that were so close they touched, and like sanitation would obviously be a big problem there. So that was awesome for any type of pre-med or pre-health student. But then I was able to spend the next 5 months studying abroad there, doing a semester of normal coursework. And since I'm a chemistry major, I was able to take chemistry classes. So I took physical chemistry and biochem, which actually happened to be a little bit easier in the Philippines, not to deter you from our amazing chemistry department that I could go on and on about. In addition to that, I also have some experience with our service immersion trips. So I did the one to Washington, D.C., and that was in my freshman year. And that really set the tone for the next 4 years of my college experiences. It really was the first motivation and first sparking of my interest in health inequity and health disparities, and the social justice mission in healthcare. And then I actually had the opportunity to lead that this year, and unfortunately it didn't happen because of COVID, but we were able to kind of adapt that trip to a remote Zoom trip, and kind of relate what we would have learned about DC to the Buffalo community and region. And then I also have a little experience with our campus ministry service immersion trips. I was able to go to Montego Bay, Jamaica, where we served at an orphanage for kids who are differently abled. And then again, I led that trip my junior year. Pretty much the same thing, although it was a very different perspective to kind of be leading in that way. So if you guys have any questions about any of what I just said, feel free to ask.
Great, thank you, Hannah. Thank you, Jack. Let's see, Caleb, do you want to share a few things that you're involved with?
Oh, sure. So, like, I'm involved with currently, or like in like whatever I've done.
Anything you like to share.
Sure. Okay. So last or 2 summers ago, I did the Summer Health Professional Education Program, which is a summer program where basically they it's kind of like a little bit like of a boot camp, but we took organic chemistry, biochemistry, and health disparities, and all of this it would be like you taking the hardest classes of like your college career, before you have to actually take them for a grade. So it really gives you like a leg up on all your classmates. Also, they provided me with at least 30 hours of shadowing. So with the program, they allow you to go to Howard Hospital, and they will assign you to doctors. So, and I was very like talkative and trying to like get a little more out of what they were giving. So I was able to like latch on to a group, like a surgical group. So there was like a doctor, a nurse, and a PA all like making their rounds together. I guess that's just what they do. And I was able to like talk to them like one-on-one about how they actually feel about their careers. It was a lot of mixed advice. Some were like, don't be a doctor, be a PA, which is very awkward to hear from a doctor, but that's something like some doctors will say, and it shouldn't deter you, but it should maybe make you think and wonder like what are they talking about. Maybe you could ask them like, hey, why would you say that, or something I should change a little bit about how I'm thinking. But yeah, I would highly recommend that program. I currently, well, not currently because of the pandemic, but I volunteer at a pediatric center. So a doctor named Dr. Fred, she asked Dr. Backstrom if she could send over any volunteers. So I signed up for that, and her clinic is on Main Street. So I don't have a car, and all other clinic opportunities were really far out. So this is like my only way to get like any kind of clinical experience by not, even though I don't have a car. And I just take the train downtown down to Main Street, and they're very, very helpful. Like they let us do like a lot of stuff. So I take vitals. I'll take like height, weight, blood pressure. I will record signs and symptoms, and that is a very unique thing because I don't have any like any kind of degree or like certification behind me. So the fact that I'm able to do all that and I'm just a rising senior is like a crazy opportunity. I also schedule appointments there. I check people in. I do follow-up calls. So it's a wonderful opportunity I feel like very a part of the clinic. I also was an RA for a bit, which was a wonderful experience. But the kids had they had a lot going on, like a lot of stuff, a lot of issues going on. But it was great experience because I had to take my hardest classes. At the same time, I had to balance other people's problems and my problems, and it really like pushed me to my limit. But it helped me like feel better. I knew I could do it. I knew I could graduate a bio major if I can balance all of my responsibilities. So that's just a little bit of stuff I've done.
Caleb, will you just explain what an RA or resident assistant is for people who haven't experienced residence hall living yet?
Yes. So when you live in the residence hall, there's an RA, and which is a resident assistant, and basically you go to your RA if you have like honestly any kind of question. I've been asked, where's the garbage? Where do I go to eat? Where is the mail room? If you just have any question, you just go to your RA, and they can like just point you in the right direction. They also are there for for emotional support to a point. They're mainly supposed to help you find the emotional support. So they're gonna they can walk you to the health center. They can help you get to counseling, but they're gonna be the place you go if you have like any kind of issue. Like if you're stressed out about academics, like they're gonna be your support system when you're at your home, away from home.
Thanks, Caleb. Let's see, Joe, do you want to share a bit about your activities?
Yeah, so a few of the non-medical, non-science things that I was involved in at Canisius was campus ministry. So I was involved in doing a lot of the retreats where you get to go away for a weekend at a retreat center, and just a nice kind of break from the daily campus life and classes. And also USA, which is our undergraduate student association. So that's essentially our student government. So things that I did related to pre-med were the PEPID internship, which was really cool because I got to go out to Arizona, work there in the office for a week, and then come back home and then continue that internship throughout the semester. it's tough to choose what to talk about because there's so many things that Dr. Backstrom provides for us. But the two that I really want to talk about is the Harvest House tutoring. So essentially that's in Buffalo, and it's a tutoring program at this place called Harvest House. And essentially it's designed for adults that are going back and getting degrees and returning to education. And a lot of the adults that we work with are becoming LPNs and nursing assistants. So we help them practice English skills and math skills in preparation for the exam. And it's just such a rewarding experience when you are working with someone, especially over the course of a few months, and then you see that they're able to get into the program, and then even 6 months after that, that they're working in the medical field. So that's something that's just a great experience. And another thing to say about that is I think as a physician or a nurse or anything, any worker in the medical community, it's so important to be a teacher and to be able to effectively communicate an idea across in communication. So I thought that has prepared me well for a future in medicine. And then the second thing I wanted to mention is there's a club at Canisius called the Society of Pre-Health Professionals, which I was in during college. And the difference is that instead of having just one club multiple clubs, that's the pre-med club, and then you have another club, the dental club, they're all housed under one roof at Canisius. And I think that's the benefit coming directly from a smaller college and a smaller institution, is that they can be housed under one. And that's so important because first of all, it's nice to have friends that I graduated with, that I'm close with, that are in dental school, that are in pharmacy school, that are now nurses. Because when you get to the real world, which I'm not in yet, but eventually, you will have to work alongside all of the different health professions. And it's, again, so important, talking about the idea of communication, it's so important to be able to work with people with different backgrounds. And that was one of my favorite experiences at Canisius.
Great, thank you, Joe. And last but not least, Bree, what were you involved in?
So at Canisius, I was in honors college, similar to, are you able to hear me? Oh, okay.
Yes.
Perfect. I was in honors college, as Hannah mentioned and Joe, and I was medical laboratory science major, which is something that Dr. Backstrom talked about, but it's a 3+1 program. And I was also pre-med. So it was kind of interesting to be honors medical laboratory science pre-med. And I can definitely speak to that. I saw that there was a question in the chat about that. But to share also what I was involved in at Canisius, I was part of the medical mission trip to Central America that Dr. Backstrom mentioned in her presentation. And we spent time there doing a lot of different things, but it was really amazing experience being in a different setting where medical delivery is very different than here in the US. And we went to rural areas and set up clinics, and we worked with the doctor down there, and it was really such an amazing experience. And that was really unique and something that Canisius offered me. And I have learned a lot from that trip, and I wrote my honors thesis actually on universal healthcare, and I compared healthcare in Nicaragua and Costa Rica. And so that trip really was able to give me something really interesting to write my honors thesis on, get experience in some political science and healthcare policy, and that was great. I also did the trip to DC that Dr. Backstrom mentioned, and she already talked about that, so I can speak about research. I did research in my summer as a Canisius student, and she talked about that in her presentation, but something really unique about Canisius is you will get really one-on-one experience with your professors. So if you're really interested in chemistry and you want to do chemistry research over the summer, you're going to work in a small lab, maybe with one other student or a couple other students, and you'll be able to work with the PhD, every day and learn from them. And it's just a very unique, special experience that you would not necessarily get at a bigger place. But Canisius is wonderful because the professors really take the time to mentor you and to help shape you into someone who will be a great healthcare professional in whatever area you decide to go in. But to answer the question about in the chat about something more, if it was more advantageous to do medical laboratory science if you were pre-med, to be honest, I would say no, because it is a lot of extra work, I would say. So being pre-med is a lot of work, and then doing medical laboratory science on top of it is a lot of work in a different setting. So the program for medical laboratory science requires you to spend your senior year at a hospital, and you spend 12 months there, really working super hard, studying super hard, and learning the practical application of clinical laboratory science. And for me, I'm so grateful for that experience, because I loved everything I learned, and I had a really wonderful time, and I loved my time working in healthcare before starting medical school. So that was something that gave me professional experience that you wouldn't necessarily get if you went straight through. But if you have your heart set on medical school and you know you want to become a doctor, medical laboratory science is a different profession. So I wouldn't necessarily recommend doing that unless you were genuinely really interested in medical laboratory science, or just building professional experience before you start medical school. Or if you're not that sure about medical school and you know that you want to get a job right out of college, there's a huge need. So you'll have great job prospects. But it really depends on you. So I would say not necessarily more advantageous. If you want to be a doctor and go to medical school, or pursue anything in health professions, I say enjoy the education at Canisius, or wherever you go to undergrad, and make the most of it, and then pursue what you want to do. Don't necessarily do something just because you think it's more advantageous, because in the end, I think you thrive the best when you just do things that you're passionate about.
Thanks.
Awesome. Dr. Backstrom, can you talk a little bit more about the different majors that are in the pre-med program, and sort of what the difference is between, why you would go into biology or chemistry, or medical laboratory science, or really, can you major in anything in the pre-med program?
Yeah, so really for any of the health professional programs, you can major in anything that you love to study. And we encourage you to look for what you really love to study. So we have students majoring in finance, in psychology, in chemistry, and biology. As Bree said, the clinical lab or medical lab science program can be great, but it is one that has some limitations in terms of timing of when you would go on to another program. But really, students major in anything. We've got students in creative writing right now. So if you want to be a physician, a dentist, a PA, a PT, any of these things are fine. There are a couple of academic programs that have such extensive requirements themselves that it can be a little more difficult to pair with pre-med or pre-health tracks. Accounting, for instance, is one that's a little more challenging. We've had people who've done it, but it extends their time a little bit. But really, the major that you choose in undergraduate, that's just what you love to study and what you want to know more of, what you can do well in. And when you talk about it, you're excited about it.
Great, awesome. We just had a question come in. Can all pre-med students go on the mission trips and study abroad programs, or is it just limited to pre-med students, or do you have to be pre-med to go on those?
Any pre-health student is welcome on any of the activities that we do. And in fact, like on the international medical mission trip, the need of the patients that we see is greatest for dental care. And so whether or not we have any pre-dental students along, the pre-med, the pre-PT, the pre-PA students, whoever it is, they all take turns helping in the dental clinic so that we can make sure that we provide the care that's needed to the patients. And then the local or the domestic medical mission trip, same kind of thing. Everybody's welcome, everybody pitches in. We've had great groups of students get trained up how to make glasses in the vision lab. So the organization has a truck with them with all the equipment. Our students learn the first day and they crank out 550 pairs of glasses in a weekend.
Wow.
Really make a big impact for people. It's very, very cool.
That's awesome.
And really important for helping students understand what healthcare direction they want to go in. So some of these experiences have changed people's minds and reaffirmed what they thought they wanted to do.
Awesome. Really cool. Does Canisius offer any help for test preparation for the MCAT or any other sort of tests that you'd have to take to get into medical school?
Yes, I can't remember if any of our people on our panel have utilized it, but we, Hannah, did you use Kaplan Prep?
Yeah, I did the course.
Okay. Yeah, so we have a partnership with Kaplan, which some people will be familiar with from their SAT prep. So we have an institutional partnership where they provide a teacher and work around the schedule that we request. And we provide space and a bunch of students, and in exchange we get a big discount on the tuition for those prep courses.
Awesome. Great. Another question just came
Fun
in.
fact, our current teacher for the MCAT prep course also won Jeopardy in January.
Oh, hey, awesome. That's a nice little, I'll have to take that one on the road here recruiting. Is it possible to minor in Spanish? Is this person specifically? Does giving a language give you a leg up? I think, does anybody here have a minor in a language or anything like that?
I can talk a little bit.
Bree and Joe can both speak to the value of Spanish, I think.
That's what I was thinking.
Yeah, so I didn't have a minor in Spanish, but I did take multiple Spanish courses here at Canisius. And I also was able to go to Argentina and Uruguay on a 4-week kind of shorter study abroad program through the Spanish department. And I think a language is so important. So I think that working in the hospitals, seeing people that maybe only speak Spanish, even if you can say a few sentences and introduce yourself, you can see the instantaneous change in their demeanor, and they get so much more comfortable working with the physician or the PA or the NP. And then also, there's a lot of tools that you can use to kind of learn these languages as well in your own free time. And I can write about that in the chat if anyone's interested.
Yeah, to piggyback on what Joe said, learning a language in the real world is very valuable. Spanish, particularly in the US, is something that you will use a lot when you're actually practicing in the community. But as far as having it down as a major or minor, I don't think it's necessarily something that important, because you can just share about your experiences being bilingual, or your experiences spending time abroad and working on your language skills. And for example, I never majored or minored in Spanish, but I have learned Spanish from traveling, and that was something that you can still include when you're applying and you can speak about, but you don't necessarily need to take it formally to, practice the language and to have it be something advantageous for your career in healthcare.
Right. I believe Caleb is actually doing some self-study right now to beef up his own Spanish skills.
Ooh, Caleb, give us a taste here. Let's hear some Spanish. No? All right. Next question that we have. What are some good extracurriculars to do well in high school in order to stand out? I'll talk about that just for a second, just from an undergraduate admissions point of view. I'm one of the people that reads applications. So what I'm really looking for on an application is that you're involved, right? You look at the 4 students right here, all 4 of them got accepted to Canisius. So congratulations on that a couple years ago to all of you. But you heard them, they're not just hanging out in their dorm room. They're out there doing things. You heard how involved everyone is. And those are the type of people that we want to have on campus. So, being involved in as many things as you can, and anything that can really help you out, and really just anything that's really going to be a differentiator on your application is really what we're looking for. And just to make sure that you're not just going to school and then going home, whether it be a job, different activities at school, you look after your little brother and sister, anything like that. Those are the types of things we're looking for. As far as like pre-med specific, I'll let you guys sort of talk about that. Some of the things that you guys have done, maybe in high school, or some of the things that you wish that you had done as a high school student to prepare you for college. So anybody can take that one.
I can speak about high school, what I would really recommend doing if you're interested in pre-med or health professions, to reach out to as many people as you can that who work in healthcare, and see if you can shadow them, because it is very helpful having an idea of what you are interested in when you come to college, because you might not necessarily have that same time. So when I was in high school, I spent my senior year doing this program that was like geared towards high school students who are interested in health. And I was able to shadow all of these different types of physicians, physical therapists, audiologists, all these different people who worked in different professions. And I thought that really helped me decide what I want to study in college, what I want to pursue. So I think something that would be really nice in high school is to spend time just for fun, exploring things, seeing what you like. And also something I recommend doing at every stage is doing some form of service. I think that that's something that will always look good when you're applying for something, but it's also just something that you can take with you and build upon while you're in college. So I would recommend that, shadowing and doing career exploration and doing service.
Great, awesome. Joe, did you want to say something there?
Yeah, I was just kind of to echo what other people were saying. You just don't want to be a prototypical applicant. You want to have passion, find your own passion. It could be anything. If you really like to garden, if you like to play an instrument, if you like to play a sport, just don't be a very prototypical applicant, classic things.
Great.
So some folks on the panel have had interesting clinical or direct patient type experience. I'm wondering, maybe people think that shadowing is the most important thing a lot of times, but to really test yourself to see if you like interacting with people and their families when they're sick and stressed is important. Sometimes you can't do that yet until you get a little bit older, but if you have opportunities, volunteering in a nursing home, right now is not the time, but when things get safe again, even volunteering in a nursing home can be a good thing. But maybe Hannah and Bree, would you talk about jobs that you held while you were in college?
Yeah, so I also did a program kind of similar to Bree. It's if you're in like the Monroe County, Rochester, New York area, we have something called New Visions, which you basically spend half your day working in the hospital and the other half taking normal classes at your high school. So through that, I was able to shadow a lot of physicians, get into the OR to see a lot of different surgeries. And that was kind of my first experience providing direct patient care. But then when I moved on to college and I became 18 years old, I was able to apply to be a patient care technician at Rochester General Hospital. And so I've been working there for over 3 years in a mental health kind of acute psychiatric unit as a patient care tech. So that's kind of a step below a nurse. During my shifts, I provide direct patient care and interact with patients and families and a staff of all different levels of healthcare professionals every shift. So that's been something that's been pretty monumental in my college career. And that also inspired my thesis, which is all about psychiatric readmissions. And I think will be a good thing in my med school application that I'm currently working on to kind of set me apart from other students who yes, might have had a lot of hours shadowing, but I have a lot of hours providing hands-on direct patient care.
Great, awesome. For
Great.
anybody really here, how do you think, especially Joe and Bree, just because you guys are in medical school now, how do you think you were prepared to go into medical school from your 4 years at Canisius, and sort of, talking about, Joe at Buffalo and Bree in Oakland, seeing other students that went through similar programs at other schools, how did you guys sort of compare to Canisius, or how did Canisius kind of give you a leg up on the students that your classmates now?
So I am at a medical school that really reminds me of Canisius, funny enough. So Canisius is Jesuit, and Dr. Backstrom talked about the Jesuit values, and the medical school that I'm at really values humanitarian education, because as a physician, you should also be a humanist and care for the whole person. That's something the Jesuits teach with Cura Personalis. And so having all of the experiences that I had at Canisius really helped prepare me for the medical education that I'm getting now in medical school, because you learn so much more in medical school than just your science classes. You need to learn how to be a great communicator, how to empathize and see from other people's perspectives, and all of those qualities, those soft skills are extremely important in being a great healthcare provider. So Canisius, I think, through all of the opportunities, they really allow you to develop into a person who has those qualities and has those skills. And additionally, academically, I would say Canisius prepared me so well for medical school. My science courses were so, not bad at all, and I took 2 years off, 2 years gap, and I remember the things that they taught me at Canisius. So the education is phenomenal. They really, they teach you to understand, and then you take that understanding with you. So I think that Canisius is an amazing choice for preparing you academically and also helping you develop those soft skills that are very important for being a doctor.
Yeah, I think that you can't know how good of a school you're attending until the next step. So I never really considered, okay, is Canisius a great school, until I got to medical school. There's about 8 or 9 of us all at UB in Buffalo, and all of us are doing very well in coursework, just like what Bree's saying. And I'm also 2 years out of school. And of course, you're going to forget some of the little specific details, but what Bree was saying is that you remember the understanding and the way you learn something. And that was taught with great teachers like Dr. Backstrom, organic chemistry professor, and a lot of other professors in the pre-med coursework. And then again, just kind of echoing what Bree said, so many of the Canisius individuals at UB are standout students academically, like I said, but also just in the community. They're involved, they're doing service, they're doing free medical clinics set up in Buffalo, and they're running them now at the end of this year, and just great communication skills as well.
Great.
I would like to add one quick thing, but I think the pre-med program at Canisius, thanks to Dr. Backstrom, is really phenomenal compared to maybe a school that's really big and the pre-med advisor doesn't even really know your story, know your name. Dr. Backstrom is a great resource, and you have a lot of mentorship as a pre-med, a lot of great opportunities that you are really invited to. So maybe at another school, you'd have to seek out these opportunities. Oh, you want to do a mission trip, you want to have these different experiences. But at Canisius, there's a lot of experience for pre-med that are very easy to find, thanks to the hard work of Dr. Backstrom and the pre-med team at Canisius. And another thing about the curriculum, I would encourage students who want to be pre-med to go to an undergrad where the science class courses are not curved, because at Canisius, they don't curve any grades. And that's something really helpful, because I think at other schools sometimes if we all do bad on this exam, then they're going to curve it, and we don't have to worry that much. But it's really not that way at Canisius. I feel like something just that helped me learn so well was because they don't curve things. They just teach you to understand. And then that's something that will help you a lot in medical school.
Great, awesome. Dr. Backstrom, I've heard you talk before just about sort of the culture of the pre-med program and with the students in the pre-med program about how it's not a competitive trying to, one-up everybody else. Can you just talk about that and sort of the culture surrounding the pre-med program at Canisius?
Sure. So because healthcare is a team sport or a team activity, health professional schools and medical schools are really looking for people who can collaborate instead of try to only get ahead at someone else's expense. Medicine is a field that historically had a bit of that built into it, and the medical schools are really working hard to get rid of that kind of attitude because it doesn't serve the patients well. So I'm really proud to work with students who collaborate with each other, support each other. Many of the people you see on the screen right now tutored while they were at Canisius, so actively helped their peers succeed academically. It's really important that, the mindset is we can all succeed as opposed to I'm going to succeed if someone else doesn't, because that just isn't the way it is. Even though it's competitive to get into health professional schools, they will always value someone who reaches out and helps others over someone else who strives to get ahead at the expense of people around them. So that's one of the things I really enjoy about the culture of the student body at Canisius.
Great, awesome. Caleb, I'm going to give you a question here. Can you talk about, you talked about how many different things you were involved in just over the first 3 years here. How do you balance all that with all the things that you're doing outside of the classroom, as well as obviously being a pre-med student is a pretty big time commitment as well?
I do a lot of time management. I also, I didn't do as well as I wanted to my first semester. So instead of just trying to do the same thing again, which is like, I guess, study the exact same way, even harder, I took my summer break and I was like, well, I need to figure out, like, my problem is I don't think I'm learning correctly. So I Googled and did a lot of research on how to study better. And that is key to being able to balance a lot of things. Now that I can study more efficiently, I have more time to balance all these extracurriculars. So instead of like studying for like 3 hours, I can study like an hour. I can study this for an hour this day, and then study it for like an hour the next day. And it just saves up a lot of time.
Awesome, great, good stuff. Does anybody have anything else they want to add here before we end, Dr. Backstrom?
Yeah, I just, again, offer the opportunity for individual conversations about your own path. If you just graduated or are just about to graduate from high school and want to be thinking about productive ways to spend your pandemic summer, reach out. Lots and lots of ideas for that. Otherwise, just you rising seniors in high school, keep challenging yourself. Make sure that you're, taking classes that are going to push you hard and make you read books and things like that, so that when you come to college, you're a little bit more in the habit of independent learning and studying hard.
Awesome.
And then maybe one of the most important things is never hesitate to reach out for help if anything gives you trouble or if you stumble along the way, because there's, like anybody on the screen here would happily help a peer. That's the Canisius culture. Our alumni will help you to the next level. Our older students will help the younger students to the next level.
Awesome, great. Well, I want to thank everybody for attending. I want to thank our panelists for giving us some time here today. Dr. Backstrom, Caleb, Bree, Joe, and Hannah. To everybody that's watching, thanks for taking the time with us here today. For all of those students that are coming to Canisius next year, we're super excited to have you already have made your decision. Anyone that's still making your decision, make sure to reach out to your admissions counselors. We're here to help you 100% of the way during this college search, and obviously a little bit different than previous years here with the college search. So happy to help out in any way that we can. But thanks again to everybody for attending, and everyone have a great night, and go Griffs.
Stay safe out there, and good to see all you guys.
All right.